Hi, my name is Dr. David Reina, and I'm a chiropractor with the Florida Orthopaedic Institute. And today I'd like to explain to you a few things regarding spinal adjustments and patients who have had spine surgery. So a common question that we have is, Dr. Reina, can you do adjustments on people that have had spine surgery? And the answer is yes. And the way I answer this is in this manner. Just like there's not one medication, there's not one type of spinal adjustment. So for example, if you have pain in your back or in any part of your body, you can take an aspirin, which is a very low intensity type of medication, or you can take an Oxycontin, which I don't recommend, but that's a higher intensity medication. Similarly, in chiropractic, we have different levels or grades of manipulation or adjustments, beginning with even just body positioning to what's called high velocity, low amplitude type of adjustments, where the patients are, quote, cracked or cavitated. So I'm going to explain a few things today regarding how we approach someone who's had a spinal fusion surgery and the type of techniques that are going to be possibly beneficial for them. So let's look over here at the x-ray so that way I can explain to you what a spinal fusion looks like. So this is the lumbar spine or the lower back, and this is the model. These square things are vertebrae. In between you have discs, and then these yellow things are nerves, and these are the holes that come out. So in this particular x-ray, these white things are called screws. In between, you have a fusion mass, and over here, this is a cage. And in this particular case, you have the lowest vertebrae that's been fused with instrumentation. When you turn it around and look from the front, this is what it looks like. So an interesting thing that occurs with the spine is that the greater the fusion or the greater the stiffness that occurs up the spine, the more these joints here called sacroiliac joints have a lot of pressure. So it's not uncommon for patients that have fusions of their lower back to not necessarily have back pain, but have SI joint pain or pain lower down in the spine. Another thing that we look for too with patients that have had chronic degeneration, in other words, the disc has a tendency to degenerate, it overloads the joint, and then the muscles become weak, is they have numb spots occurring across the lower part of the back. So you have difficulty not only with movement because the muscles are weak, but because you're stiff, because there's numbing sensation. So what we want to do is show you a few different techniques of how to improve the sensation and improve the sensation of movement through the spine with somebody who's had a lumbar fusion. So we're going to come to our assistant over here. I'm going to have you lay on your stomach for me. Head over there with a paper. So one of the first things that we'll do is we're going to get something like this, a paper clip. I like using paper clips because first of all, they're not going to cut you if you use them correctly. Number two, you can get a lot of them for not a lot of price. And number three, you can change them so you can always have a clean paper clip. So what we'll do is really simply, we're going to check the sensation of the spine. So Allie, how does that feel?
Kind of hurts.
Kind of hurts? Okay.
Poking, yeah.
And then on this side, how does that feel?
About the same.
About the same?
Yeah.
Okay. And then right when we get to here, how's that feel?
About the same.
Okay. And then here?
Yeah.
Right. So she's got normal paraspinal muscle tone, which would be usual in somebody who's pretty healthy. But what can occur when you overload the joint is you'll poke one side and there won't be any sensation and there won't be any response. So what we do is with the thumb, I'll use our model here, there. What I'm going to do is I'm going to take this, my thumb, I'm going to pull this over, and this gaps the joint. When I gap the joint, I take the pressure off the joint, which then reduces some of the pressure of the nerve, and then I can send the signal in. So once that's all of a sudden the signal starts to occur, notice how she jumps? That's called a withdrawal response. It activates the muscle. Once it activates the muscle, we can then do what's called flexion distraction. Another chiropractic technique. So if you can move around here, I'll show you. Once there's sensation to the spine, I'll go to the specific segment that I want to stimulate. I'll put my hand right in this manner, holding the spinous process, just like this. And then what I'm going to do is I'm going to distract so we can open up the hole, take the pressure off the nerve and the joint. And right here, hold it, and then let your breath out, blow, and then just a slight distraction. I instruct the patient to let their breath out because when you let your breath out, what you do is you drop pressure within the spinal canal, And you also contract the little tiny muscles that stabilize the spine called the multifidus muscles and the transverse muscles, which are also part of the core muscle groups. So when you're doing flexion distraction and you're breathing out, you're actually doing a multitude of techniques. And again, we just stretch. This is called a static technique. Static because I'm holding this position for approximately 15 to 30 seconds. There's also a kinetic technique that we can do where we put motion in the spine. Now with some of the patients that are having multiple levels of fusion that we want to start to introduce movement, they're pretty stiff. So in order to have better control of movement, what we like to do is put them on the table, and let's say I want to induce motion through the spine. What I'll do is I'll actually move them. Notice how the table moves? So I'm able to take them away from weight bearing, and I'm able to actually have them introduce movement into the spine. And this does one of two things. First of all, it's going to get them accustomed to movement across this region where they've had fusion, number one. And number two, if there's some underlying pathology, let's say they have some hypermobility, let's say they have a fracture in the region, let's say they've had some stress on the joint, as I'm moving them in a controlled passive manner, if they have localized pain, then we can find it. And then now we can direct them to either imaging or back to their surgeon with some more information. There you go, come on up. So this is just one of a multitude of techniques that we use with patients that have had fusions. And again, the take-home message of something like this is that there's multiple techniques that you use in chiropractic. And what you have to do is you have to evaluate the patient and the condition and the body type and what you want to address. This is David Reina from Florida Orthopaedic Institute. Have a safe day, Tampa.